Pre-birth openness to air poisons may build newborn children's weight hazard. Ladies presented to more significant levels of air contamination during pregnancy have infants who develop abnormally quick in the main months after birth, putting on overabundance fat that puts them in danger of heftiness and related infections sometime down the road, new CU Boulder research shows. The investigation of Hispanic mother-kid sets, distributed for the current week in the diary Environmental Health, is the most recent to propose that helpless air quality may contribute at any rate to some degree to the country's corpulence scourge, especially among minority populaces who keep an eye on live in places with more openness to harmful toxins. Around 1 of every 4 Hispanic youth in the United States are stout, contrasted with about 14% of white youth and 11% of Asian youth. Higher paces of weight among specific gatherings in our general public are not just a result of individual decisions like exercise and calories in, calories out. It's more muddled than that, said senior creator Tanya Alderete, an associate educator in the Department of Integrative Physiology. This examination and others propose it can likewise identify with the amount of a natural weight one conveys. Past research has shown pregnant ladies who smoke or are constantly presented to air contamination will in general have more modest birthweight infants. In the primary year of life, those infants will in general competition to make up for lost time, putting on weight abnormally quick. Sped-up weight acquire in early life has been connected to diabetes, coronary illness and weight issues in youth and puberty. This period, either during pregnancy or not long after birth, is a basic window of advancement, and unfriendly openings can program the baby to have a large group of issues sometime down the road, said lead creator William Patterson, a doctoral understudy. To all the more intently look at what explicit poisons mean for a child's development direction, the scientists followed 123 mother-baby sets from the Mother's Milk Study, a continuous preliminary in the Los Angeles area. Around 33% were of typical weight pre-pregnancy, 33% overweight and 33% large. The scientists utilized information from the U.S. Natural Protection Agency's air quality system, which records hourly air quality information from surrounding observing stations, to evaluate their pre-birth openness to 4 classes of toxins, PM2.5 and PM10, inhalable particles from production lines, vehicles and building locales, nitrogen dioxide, a scentless gas discharged from vehicles and force plants, and ozone, the principal fixing in exhaust cloud. Sound propensities for pregnancy. Most recent science show maternal propensities influence pregnancy achievement. Maternal and fatherly incendiary infection can influence pregnancy results. Marine plastic contamination among the top marine-related dangers of public concern. Then, at that point they followed the infants, intermittently estimating their weight and tallness, yet in addition how much fat they conveyed and where. We tracked down that more prominent openness to pre-birth encompassing air contamination was related with more noteworthy changes in weight and adiposity, or body bloatedness, in the initial half year of life, said Patterson. Sometimes, poisons appeared to affect guys and females in an unexpected way. For example, openness to a blend of ozone and nitrogen dioxide in utero was related with quicker development around the midriff in females, while in guys it was related with more slow development, long and more prominent fat aggregation around the waist. In grown-ups, abundance fat around the midriff has been connected to coronary illness and diabetes. It's difficult how much fat you convey, however where that is important, said Patterson. How could breathing in poison sway development? Examples of a mother's unborn youngster. Scientists accept those contaminations can kindle the lungs and, thusly, cause foundational aggravation of organs, affecting metabolic cycles, like insulin affectability, that can impact fetal turn of events. Toxins have likewise been displayed to affect quality articulation in newborn children, conceivably having deep-rooted impacts that could rise above ages. The creators note that the examination incorporates a moderately little example size. Furthermore, on the grounds that the investigation included just Hispanic moms, a bigger preliminary is important to affirm results apply to different populaces. However, Alderete said that in an undeniably assorted country, where racial minorities have been shown over and over to bear a higher weight of contaminations, it's essential to concentrate what those poisons are meaning for them. In 2018, the EPA's National Center for Environmental Assessment distributed an investigation showing that destitute individuals and minorities are presented to as much as 1.5 occasions more airborne contaminations than their white partners. By and large talking, there have not been a lot of studies that truly address the variety we have in the United States, she said. We need to fill that hole. Interim. The specialists prescribe pregnant ladies play it safe to limit their openness to air contamination by shutting windows on high ozone days, not practicing outside now and again of high air contamination, and avoiding exercises close by occupied streets.